Hi, today we want to talk about the pharmacologic treatment of pain. This chapter was included in Humans and written by Dr. Pinker Dover, Dr. Choi, and Dr. Peterson. Many classifications of pain exist in the literature. Today we're going to focus on cancer versus non-cancer, acute versus chronic, and different types of pain such as nociceptive, inflammatory, and neuropathic. It is important to understand the underlying pain mechanisms so that we can better create medications that address these mechanisms. Nociceptive pain is transmitted through the A delta and C fibers to the dorsal horn and relayed to the thalamus through the spinothalamic tract. Voltage-gated sodium ion channels and excitatory via glutamate and inhibitory via GABA interneurons help modulate this system. Inflammatory pain is caused by the release of histamine, serotonin, bradykinin, substance P, leukotrienes, cytokines, neurotropic factors, and prostaglandins. These upregulate voltage-gated sodium channels, cause conformational changes in transducer proteins, and increase calcium influx in second messenger systems. All these lead to the sensitization of already activated nociceptive receptors and activation of dormant ones. The emotional salience of pain is processed through a network involving the insula, striatum, parietal associative cortex, and lateral prefrontal cortex. Multiple classes of medication have been created to address these pain mechanisms. Non-steroidal anti-inflammatory drugs work via the selective and non-selective COX inhibition, which causes downregulation of prostaglandin and thromboxane synthesis. Acetaminophen or Tylenol works by inhibiting prostaglandin H2 synthase and decreases prostaglandin E. It also decreases the oxidized form of COX and possibly blocks the uptake of anandamide, which inhibits the vanilloid receptor activation in nociceptors. Antidepressants work via multiple mechanisms. Their main goal is to increase the serotonin and norepinephrine in the synaptic cleft, which reinforces the descending inhibitory pathways from the CNS to the dorsal horn. They do this by either decreasing PGE2 and TNF-alpha, activating delta and mu opioid receptors, or increase GABA-B receptor function, causing A1 receptor activation. They may also inhibit NMDA receptors, block calcium and voltage-gated sodium channels, and activate potassium channels. Antiepileptics work by either blocking calcium channels on the nerve terminal, preventing neurotransmitter release, or blocking sodium channels to suppress the ectopic nerve conduction. Lidocaine and mexiletine both work similar to antiepileptics by blocking sodium channels to suppress ectopic nerve conduction. Opioids work via the activation of pre- and postsynaptic mu receptors. Here is a quick diagram showing the different types of pain, the quality of the pain, and the classes of medication you can use to treat these types of pain. We will now break this down. For cancer-related pain that is nociceptive in nature, we recommend the use of NSAIDs, antidepressants, antiepileptics, opioids, or other medications such as acetaminophen or tramadol. For neuropathic cancer-related pain, you could try antidepressants, antiepileptics, or other medications such as lidocaine or mexiletine. For inflammatory type pain related to cancer, recommend NSAIDs or other medications such as acetaminophen. When dealing with non-cancer pain, it's important to distinguish whether it's acute pain or chronic pain that you're trying to treat. For acute nociceptive, we recommend NSAIDs, opioids, or other medications such as acetaminophen or tramadol. For acute neuropathic pain, we recommend the treatment with antidepressants, antiepileptics, or other medications such as lidocaine and mexiletine. For acute inflammatory pain, you could try NSAIDs or other medications such as acetaminophen. For chronic nociceptive pain, we recommend NSAIDs, antidepressants, or other medications such as acetaminophen or tramadol. Important to note here, we do not recommend the chronic use of opioids for nociceptive pain. Chronic neuropathic pain can be treated with antidepressants, antiepileptics, or other medications such as lidocaine or mexiletine. Chronic inflammatory pain can be treated with NSAIDs or other medications such as acetaminophen. It is not recommended to use opioids for the treatment of chronic pain. Opioids have been overused in the U.S. for many years and has led to an opioid crisis. In efforts to reduce the overuse of opioids, many centers have created guidelines for the prescription of opioids. Here we provide links to 3 of those guidelines, including the Centers for Disease Control and Prevention guidelines, the American Society of Interventional Pain Physicians guidelines, and the U.S. Department of Health and Human Services guidelines. For further recommendations regarding the use of opioids, please see our chapter. Thank you.